Good evening to everyone present here. A warm welcome to all. Good evening to everyone present here. Warm welcome to all. In connection with Dhanvantari Jayanti, Department of Rog Nidan of Ayurveda College and Hospital, Coimbatore, and IR Ayush has been organizing a webinar series, and today marks the day 5 of it. The topic of today's session is Introduction to MRI, Interpretation and Essential Concepts. Dr. Mahesh Sir is Associate Professor and HOD, Department of Rog Nidan at KJ Institute of Ayurveda and Research, Savli, Vadodara, Gujarat. Sir has over 10 years of teaching experience and has treated several patients with his diverse clinical knowledge. He has presented several papers on topics like Ayurvedic management of pityriasis urginoides, the clinical outcomes of Ayurvedic osteoporosis management, a case study, Ayurvedic management of Ardhava Bedaka, etc. He has also been a key guest speaker at several occasions and has shared his knowledge on topics like vitiligo and rasayana in prevention of diseases and geriatrics to community health officers, hemophilia, etc. Besides this, he has several papers published under his name on topics like management of inflammatory bowel disease in Ayurveda perspective, a case study, review of idiopathogenesis of senior. Sir has also organized several seminars and workshops with the national level. Thank you, sir. Your journey inspires us to never stop learning and marketing. I now request sir to enlighten these students with his plethora of knowledge.
Very good evening to all present over here. Today, just taking an attempt to present the basic MRI concept and essential things we need to know before going to detail study about MRI and all. So we'll go to the session before that, the Dhanvantari Vantana. So first of all, I bow my head to Lord Dhanvantari. Is the supreme power of uh, the supreme doctor. So, coming to the topic, uh, the diagnosis is a very essential aspect of Ayurvedic treatment or any treatment, any system of medicine. Diagnosis, according to Ayurveda, is find root cause of the disease and Rogamadau Parikshede Tadanantara Mokshadam, it has been told. First, we have to find out the exact reason that which is the disease is being affected with, and what is the exact reason, and what is the things behind it. That has to be very much clear. Then only we can able to start the treatment aspect. Otherwise, it will be very difficult to provide medicine without which knowing the exact pathology or cause behind it. So the diagnostic investigations are the eyes through which we see hidden truths of the body, illuminating the path to healing with very clarity, precision, and wisdom. In the quest of health, they are not mere tests, but the key to unlocking the mysterious things within. So, with that, I'm going to start my presentation. So we will be discussing regarding the introduction to MRI, what are the basic uh, mechanism of MRI, and regarding the brief about the anatomy, abnormality, and artifaction, discussion and conclusion we'll be talking about. First of all, MRI, the magnetic resonance imaging. Magnetic resonance imaging is a non-invasive imaging technique which is used to create detailed images of the organs, tissues in the body. Compared to the other ionizing radiation like CT and all, which is more having ionizing radiation compared to that of MRI. But in MRI, that utilizes strong magnetic field and radio waves to generate the images as such. MRI is actually particularly useful for imaging the soft tissues, brain, spinal cord, and joints. So, come to the basics. MRI machines, which consist of a large magnet of radio frequency coils within, and when the patient is lies inside the magnetic field aligns the hydrogen atoms in the body. These radios are sent to through this body, that which is disrupting the alignment, and when radios are turned off, the hydrogen atom return to their original position. that which will release an energy that is detected and used to create the images. That is a basic mechanism which is lying in it. So this MRI mission, which is consist of a magnet, radiant coils, radio frequency coils, etc. So the core component is the magnet. Usually, the superconducting magnet generates strong magnetic field, that is 1.5 to 3 Tesla or higher frequency it will be having, and that aligns the hydrogen atom in the body. Regarding the gradient coils, these coils create varying magnetic fields that allow the that spatial localization of the MRI signals. Then that will which is enabling the creation of images of different planes. Regarding the radio frequency coils, the coils which is transmitting the radio frequency pulses to excite the hydrogen atom in the body, then receive the emitted signals from the body as such. Come to the table. There is a patient table, that is a motorized platform that moves the patient in and out of the magnetic opening, and which is associated with a computer system that process and receive the signals, and which is reconstruct them into images which can be viewed in a monitor, and according to the positions and according to the planes they will be still it, and that it will be taken and used for diagnostic aspect. And apart from that, there is a cooling system is there, that which is keeps the superconducting magnet at very low temperature, often using that cooling system is based on the liquid helium. And how the MRI works, we already told there is a strong magnetic field is there. So when the patient is placed in the MRI machine, a strong magnetic field is that which aligns the hydrogen atom and protons within the bodies, and we have already told the within the direction, and radio frequency pulses are applied that which will be disturb the alignment, and field is turned off, the protons return to original alignment, then which is releasing the energy that which will be captured, and that which will be utilizing for the MRI images. So how the signals are detected, these released energies detected RF coils, we have already discussed regarding the RF coils, and that which will be transferred the electric signals. So image reconstruction base, that is we already discussed regarding the computer which is produced these signals, they will be taking and that will be produce the different cross-sectional images. And before the patient is getting to the MRI room, some preparations are required. So a patient or person who has to undergo MRI scan, he has to inform about the detailed medical history. A doctor or the person who is in the MRI room has to notify all the medical condition, especially kidney problems, pregnancy, any metal implants, pacemakers, stents, or artificial joints, like that is the metal implants and all. Usually, that first trimester, this MRI scan is not recommended until unless it is a very essential. So these things has to be very clearly noted, and what and all the metal objects in the body that is has to be removed, like jewelry, ear piercing, watches, eyeglasses, and any other metallic item should be removed before the scan. The metal can interfere the strong magnetic field, as it is a very strong magnetic field as such. Next, regarding the fasting requirements, depending upon the MRI, especially with the contrast dye which is you using for the clarity, it may need to avoid eating or drinking for a few hours, because sometimes the person is lying down and sometimes there will be cough or aspiration should not be happen. That's why it has been recommended like that. And while clothing in the MRM, usually they will be given a gown with a tie in it. There will not be any buttons or any metal part in it. There will be loose fitting clothes without metal zippers or snaps. In many conditions, most of the time they will be providing their own gown as such. And Regarding the medication, the detailed about the medications which he is taking has to be noted. And regarding the patient's comfort, we have to ask about the claustrophobia concern. So claustrophobia is the condition where the person is very much anxious regarding to be in a closed room or closed environment. So if the person is having a claustrophobia or feel anxious or claustrophobic, it has to be very much important to be noted that it has to be informed to the person or a doctor. They may provide some sedatives or something to get patient to get relaxed. And before, if you want to, if usually taking an MRI means at least half an hour before one has to reach the place, necessary paperwork all over the patient preparation and all is very much necessary. And the contrast dye considerations, if it is regarding the angiogram or brain angiogram and all, it has to be taken when the contrast dye is being used. Inform the radiologist about any allergy if it is countered in previous experiences, or there means it has to be very priorly uh, informed. And regarding the pregnancy, the pregnant woman should inform their doctor as MRI scans are generally avoided during the first trimester unless absolutely it is necessary, as we have discussed. And in MRI scan, to avoid the artifacts, the person has to be in a very still, stay still. So MRI scan requires patient to be remain still for clear images. So practice relaxation techniques if it is needed or which may be required. Next is when this MRI scan has to be done. Which are all the indications for MRI scan? So neurological disorders like brain tumor, stroke, multiple sclerosis, and other brain conditions which is recommend to have MRI. Apart from that, musculoskeletal issues like ligament tears, joint abnormalities, spine issues, or even cardiac imaging, assessment of heart structure and function and all, life, this one and all, it will be very uh, essential and which will be more useful. And apart from that, abdominal imaging concerns, liver lesions, pancreatic conditions, renal imaging, and some up to some extent cancer detection and staging also MRI has been using. So while talking about the MRI, it is very important to know about the sequence. MRI sequences are very, very, very important thing regarding which area of the body is being going to highlight or what is we are expecting to diagnose in that. So according to that, so the sequences are very important. Different MRI sequences are used to highlight various tissues and abnormalities. In that T1 weighted images, T1 weighted images or T1W, it is mainly used for the structural aspect, best for anatomy. And in that T1 weighted sequence, it will be more highlight the fat. The fat which will be shows very bright. For example, it will be very useful in case of fatty liver, identifying anatomy around the tumors within it, or post contrast enhancement. In such conditions, T1 weighted images are required for that T1 weighted sequences. Or while talking now onwards, we will be looking on to the MRI scan. Means first we have to see whether it is a T1 weighted or T2 weighted, or which is whether it is STEER or DWI. So all these things are highlighting different aspect of the body parts in that contrast, or the more bright it will be regarding depend upon the conditions. When we come to the T2 weighted images or sequence, it will be more useful in case of best for pathology. The fluid part is more bright in case of T2. As we discussed in T1, the fat part is more bright. In case of T2, the fluid part will be more bright. For example, in case of identifying edema in stroke or inflammation in the joints, and all T2 weighted images are more. I have just shown two images over here, that which is showing the fluid. In second one we can see the cerebrospinal fluid in, and first one you can see the fat in the brain areas. You can just observe. We'll come to it later. Again, next one is flare. Flare images, which is mainly suppresses the fluid signal. Fluid signals will be suppressed, and which enhances the visibility of lesions. If there is any abnormal lesions are there, just like we can say in Dawson's finger appearance in multiple sclerosis, or any other white matter lesions which is appearing, and periventricular lesions, all those things which we can more we can see with the flare. So identifying demyelinating lesions in multiple sclerosis, that also which is uh, very much helpful in case of flare types of sequence. Next is diffusion weighted imaging, or which is DWI. DWI is that which is restricted drift diffusion, means example stroke or abscess which will be there, means that which will be more highlighted, or that which will be more looks bright. You can see over here the conditions in brain, that which will be that stroke area or abscess area is there, means that only that which will be more highlighting. Next one is ADC, apparent diffusion coefficient. So in this condition, that is a comparatively low signal restricted diffusion, which mainly confirms the pathology and differentiate from T2 shine through effects. In T2 we have already told that which will be more giving highlight to the fluid, but here which will be restrict the diffusion, and pathology will be differentiate from the condition as such. So in critical acute stroke diagnosis, or any cellular areas in tumor, all these conditions which will be more helpful. Acute ischemic stroke or abscess which will be more clear in case of ADC appearance or ADC sequence. Next is in MRI, the contrast material. Contrast materials are there in every imaging techniques, but in compared to other, the gadolinium is considered as less side effects. Means comparatively to compare to the other contrasting material, gadolinium is a very less side effect, or it comparatively no, it is very safe for all type of patients, commonly used in MRI to enhance the visibility of the blood vessels and tissues as such. So when the in this contrast material has to be used, that is more detail needed imaging, like especially like detecting tumors, inflammations, or any vascular conditions, or any vascular changes, all those things which will be more clear, angiogram, brain angiogram, and all, which will be more convenient with the gadolinium or contrast material use as such. Next, what is the advantage of MRI scan compared to other imaging techniques? MRI is non-invasive imaging technique that does not involve any ionizing radiation compared to that of the CT scan, and compared to others, the high resolution images which will be getting, that which will be produce high detailed images, soft tissues, and which will make it excellent for neurological and muscular skeletal conditions. And versatile application useful in wide range of medical fields including oncology, neurology, cardiology, rheumatology. So all aspect which is a wide range of applications are there. And functional imaging also can be done with the MRI, can provide information regarding the blood flow and tissue function, etc., which will be very clear in it. Come to the disadvantagement, the first and foremost thing is the opening area, which will be comparatively moderate one. If the very obese person may not be getting to the machines, if it is very obese, means that is a one problem which is there. Apart from the cost, MRI scans are generally more expensive than other imaging modalities like CT or X-rays. And regarding another thing is time consuming. Scans are taking longer than other imaging methods because it has to be stay still. If any small change of positions or small position changing, which will be cause artifact. That's why it will often requiring more than 30 minutes to get a accurate, clear but pictures as such. Next is one is patient discomfort. Patients with claustrophobia, we have already discussed on patient preparation. So, patients with claustrophobia may find the enclosed space which will be more uncomfortable. The other part is metal implants. The patient with certain metal implants or devices, etc., pacemaker, may not be eligible for MRI due to safety concerns. But nowadays it is most advanced. These things also will not be a problem like that. Machines also nowadays it is coming as such. Came to know, and limited availability, not as widely available as other imaging modalities, and it is very expensive, and that areas we cannot be get each and everywhere until unless it is a metro city. It will not be there, so especially emergency setting, it will be a little bit problem as such. Next come to the see one first and foremost thing is any imaging techniques we have to go thoroughly with the human anatomy as well as radio anatomy is very important. Just I am telling about, I'm not going to detail about the anatomy of MRI image. MRI image typically displayed in three orthogonal planes, mainly axial, that is horizontal slices through the body, coronal, that is vertical slices from the front to back, sagittal, vertical slice side to side. These are the main planes which will be used to get the images as such, and each and every aspect regarding the cervical MRI, regarding the lumbar MRI, regarding the whole spine MRI, regarding the brain MRI, each and every part and each and every part, how to identify in radio anatomy. It is a very vast topic, and it is very important that once we have to get into the normal condition, then only we can moreover identify the abnormal things as such in it. Next is steps to read the MRI. First and foremost, review the patient history and identification of the for the scan is very important. Uh, it is said that not always all the investigation reports may not be always correct. Sometimes there will be the positioning that issue may be cause some changes, and each and every radiologist will give interpretation in slightly in a different way. uh, Means core it will be right, but it is a human error may happen. That's what I would like to highlight. And so assess the images in appropriate planes is very important, and identify normal anatomy for comparison. So how it will be looks in a normal MRI, and you have to then go. So these are all day by very 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 experienced in seeing the MRI, then only we can able to interpret. Even though most of the time which require a radiologist help to pinpoint the exact hidden changes and all, and look for the abnormalities such as masses, edema, hemorrhages. That's what we already discussed regarding the sequences of MRI is very important. Why these sequences are important, what it has been highlighting, these things very very thorough, and utilize different sequences to clarify the findings. Then clinically, what is his complaints? Then only we can get a clear picture regarding the diagnosis. What are the common abnormalities which we can see in MRIs? One is tumor, appears normal mass, may enhance with the contrast, edema, swelling. So areas increased signal intensity on T2 weighted images. Hemorrhage may occur in hyperintensity on T1 weighted images depending upon the age and degenerative disc disorder. A decreased signal in the intervertebral disc, that which will be highlighted. We can see here regarding the can see here uh, brain tumor. The first one is mainly highlighted. Next is the subdural hemorrhages in the you can see the skull area and sides of this one, and cerebral edema. How it will be looks. This is the pattern which these conditions which will be look like. And the artifacts, the positioning errors do happens with the MRI. That's why already mentioned that it will be time taking process, at least 30 minutes to 1 hour or more than 30 minutes, which will be required to get a proper MRI scan to be get completed. As such, motion artifacts caused by patient movement during the scanning, and the chemical shift artifact which is occurring the fat water interface causes the displacement as such, and susceptibility artifact which is caused by the magnetic field in that is homogeneities, mainly affecting the areas near the air tissue interfaces, that which will be these are the common artifacts which will be seen in case of MRI scan as such. You can see the normal cervical MRI over here. Regarding the different aspect where it will be considered the sequence according to the changes of the sequences. Next, we will be talking regarding the abnormalities in this particular MRI scan. You can see the changes in the disc bulges in the L4, L5S1 level and L3, L4 level. So here a desiccated disc, which refers to intervertebral disc, and that has lost the hydration, and the condition often associated with the natural aging process. Intervertebral disc mainly act as cushions or shock absorber between the bones of the spine, that is vertebra, and they are primarily composed of a gel-like center that is called as nucleus pulposus, and with a annulus fibrosis covering. And sometimes there will be disc bulges happen, even sometimes the annulus fibrosis which will be rupture, and the nucleus pulposus which will be coming out also, we can see in some conditions. When the disc becomes more desiccated, it means eroded, it means that that has lost its water content or dehydrative changes, that which is leading to reduced flexibility and height, which can cause the exacerbate the spinal conditions or like degenerative disc diseases. The symptoms of a desiccated disc may be mainly back pain, severe back pain, stiffness, sometimes radiating pain, and the root nerve compression is also which will be causing the radiating pain, and nearby nerves also getting affected in such conditions. Here is another example for T1 and T2 type. You can see the spondylolisthesis condition. It is see the L4 and L5 level. There will be slipping. That is mainly the lumbar vertebra moving forward with the fifth lumbar vertebra. Fourth and fifth lumbar vertebra moving forward, and the second one you can just observe. So the displacement can be lead to the spinal instability and various symptoms which will be associated like lower back pain, radiating leg pain, numbness or tingling, that which is causing by means of that nerve root compression is getting affected or in this condition. Displacement can be lead to spinal instability and the aforesaid symptoms also. Here is another example of a spinal MRI. Here, the coda icuna area you can, moreover, which will be slightly visible. Rest you can see the cerebrospinal fluid. So in this also you can see the square-shaped area, that is L2 level. You can see the yellow area which has been marked. So square-shaped vertebral body of a vertebra, that is yellow outline, and the spinous process, that is a blue line over here. This is the spinous process of posterior arch, and the junction of the spinous process with the lamina make up the anterior border of the this one. You can see over here, and the covered with the ligamentum flavum. The green area which is shown is the ligamentum flavum as such. So the extremely hyperintensed areas, that is extremely hyperintensed space, almost pure white areas you can see between the vertebral bodies and posterior thecal sac. That is the thecal sac. More of the time we will be getting the report as a thecal sac indentation, and all you can see as in the red areas. This area is the thecal sac as such. And apart from that, there is in brain MRIs also there will be white matter changes, which we can see in the periventricular area, white matter lesions, that wool appearance you can see. And apart from that, the Dawson's figure appearance, which we can see in case of brain MRI. I'm not detailing go with the brain MRI as such. And one more thing I would like to say is another one is because of the dehydration changes which was happening with the vertebral body, the disc itself will be herniated towards the body of the vertebra itself. That is called as Schumol's nodes. Schumol's nodes, which is mainly the disc which will be herniated towards the vertebral body centrally. So that is called as Schumol's nodes as such. So that is that. If you have any questions, we can ask over.
Thank you, sir, for the wonderful answer. Uh, am I audible, sir?
Yes, yes. Tell me.
Yes, sir. Sir, just in case of children who are like newborn babies or in that age, and brain MRI has to be taken, MRI of the brain. So in
Hmm.
that case, how is it done, sir? Is it like can we do it for the children or any special cases?
So regarding brain MRI for children, it is so for MRI if it is required means these are the changes it is there. So preparations are there, and to be stay still is very important in regarding the children. It will be little bit difficult condition. During MRI, laying still will be more challenging when children will not be say as we say as such. So, so
So
the
is there
position.
anything? Any other thing that is followed apart from MRI in case of
So
children?
usually the
Because
children's head will be keeping, if it is a brain MRI has to be done, the coil they have to keep more towards the coil, then the MRI can be positioned and that MRI can be captured the image. That is the only thing which we can do.
sir, you talked about the contrast. Can you brief about that?
Contrast regarding the uh, MRI sequences I have told regarding the where the fluid which will be more clear in case of T2 and the fat decisions which will be more clear in case of T1 as such. So according to that only we have to approach the. So now we are not going to in giving interpretation to the MRI, but as a clinician, when it is come to us, we have to more as a learner we have to see for which plane it is and which is the sequence which is there and what is the exact reason, then exact pathology in it, then only we can able to learn in a systematic way.
Sir, in case of injury, because my heart
Pardon?
rate,
Pardon?
sir, in case of RTA, spine injury and affect like in that case, which position and what that how the MRI play a role in that?
So
Like in
that is
basic
again
spine.
depend upon the area which is getting affected. Then we have to, as such we said no that the conditions case also we have to do it.
Sir, any later advancement in MRI
Latest advancement in the
beneficial.
as such we have, so before it was very difficult to take the MRI with the implants and pacemaker and all. Now there is advancement is there. The safest missions are came to, even we can do it with that also.
Well, and in case of pregnant women, you mentioned that they can't actually expose to MRI in the first place. And suppose in case we have to take the MRI, then what should we do?
It can be done.
So can you brief us about the role of MRI in oncology? Basic things that
Oncology. I'm not that much experience uh, expert in talking regarding that.
apart from the like the common things that we
I cannot hear
like the
you.
common ways we get am I audible now, sir?
Yes, yes, yes. Tell me.
Yes, sir. Sir, can you brief us about the common ways getting in the OPD
Huh.
where we will have to suggest the patient to go for MRI?
That is mainly one is cervical spondylosis, cervical spondylitis, lumbar issues like severe IVDP and subluxation. Recently also it has been seen that a severe case of rheumatoid arthritis with Atlanta occipital subluxation,
Yes,
and that is came with the MRI only. And second thing is in such conditions like the dehydrative and degenerative changes, it will be more helpful. And regarding any spinal compression, vertebral injuries and nerve injuries, all those things which will be very much as maximum time in OPD level cases which will be more of musculoskeletal cases only come. Rarely they will become with multiple sclerosis changes and early atrophic changes of brain in case of old age people. Even in case of Parkinsonism conditions also coming with MRI. So we are not prescribing MRI, but they will be already diagnosed cases are most of the time we are getting with the OPD basis.
And finally, more on the so I would like to thank the speaker of the day, Dr. Mahesh on behalf of the Ayurveda College and Hospital Hospital and all the other students for having special time for us. Thank you, sir. Next, I would like to thank our beloved principal, Dr. Mahesh MP, sir, and the executive of the Department of Road and Hands, Dr. Devi Hands, for their vision, effort, constant support, and guidance to work with people. Last but not the least, I would like to thank Dr. Samuel and the entire team of IR Farmers. Without this, the webinar will not be possible. Thank you, sir. Thank you.
Thank you, Ananol.
And
I ask Ayush and Ayurveda College Coimbatore, and it is a very great platform, and it is a very initiative which Ayurveda College Coimbatore and the whole team who is wholeheartedly working over here. I especially thanks to them because this is a initiative and it is a model for others to start such initiative. Then only the knowledge gaining is a continuous process. So it is very important that it will be very useful for the all the budding upcoming clinicians and doctors as such. Thank you so much.
thank you. The session is very important.
Yeah.
Thank you everyone for joining us. Let us meet on